Hello and welcome. If you care for a child who needs a lot of support to stay safe, you might have heard the term deprivation of liberty. This video will explain what it means, when it applies to your child, and what it might look like in everyday life. Deprivation of liberty is a legal term. It means that a person's freedom is being limited in a significant way, usually to keep them safe. For children with disabilities or complex needs, this can happen when they need constant supervision, can't leave a place freely, or have most decisions made for them because they aren't able to make those decisions themselves. The law says that everyone has the right to liberty, but sometimes, for safety, some restrictions are necessary. These restrictions must always be in the child's best interests and be the least restrictive option possible. For children under 16, parents can usually agree to restrictions if it's needed for their safety. But for children aged 16 and 17, the law changes. Parents can't always consent to these restrictions on their child's behalf. If a 16 or 17-year-old lacks the capacity to make decisions about their care, any deprivation of liberty must be authorised by a court, usually the Court of Protection. For children under 16, if the restrictions go beyond what's normal for a child of that age, especially if they're in care or a hospital, the court may also need to be involved. Deprivation of liberty isn't just about locked doors. It can include needing staff or carers to supervise your child at all times, even at night. Not being allowed to leave a home, school or hospital freely. Having most daily decisions, like what to eat, when to go out or who to see, made by others. Using physical restraints or medication to prevent harm, but only if absolutely necessary and as a last resort. Not being able to have private time or contact with friends and family without supervision. The key question is, are the restrictions greater than what would be usual for a child of the same age who doesn't have a disability? If so, and if your child can't consent, it may be considered a deprivation of liberty. If your child needs these kinds of restrictions, professionals must make sure it's done legally and in your child's best interests. There are safeguards in place to protect your child's rights, and you have the right to be involved in decisions, to ask questions, and to challenge decisions if you're worried. If you think your child is being deprived of their liberty, talk to their care team or social worker. They can explain what's happening and make sure the right legal steps are being followed. Remember, these laws are there to protect children and families,